The Tories are desperate to blame problems in the NHS on striking nurses and ambulance drivers, but NHS users aren't buying it. Check out this interaction between the mother of a young patient and Health Secretary Steve Barclay.
They're being worked to the bone, and actually the level of care they provide is amazing, but they're not being able to provide it in the way they want to provide it because the resourcing is not there. Like I said, on Monday we were due to be in, and the number of people coming through the door is too many, and it's not fair to blame it on the pandemic anymore, is it? Because actually we had problems in the NHS before we went into the pandemic. We were short of doctors, we were short of beds going into the pandemic. So I think it's really wrong to blame it on the pandemic. And actually the damage that you're doing to families like myself is terrible, because it was agony for us as a family, waiting for that call and preparing our children for their sister and her hospital visit for then it to be cancelled. And I know you look and we're all numbers, but actually there are people waiting for care.
Of course. Well, there's a problem myself on that.
Yeah.
Absolutely. So,
and I think this problem with beds, a lot of it's the health and social care, isn't it? We have people that can't get into health and social care and are taking up beds. So until you as a government prioritise health and social care, we're not going to free up the already limited number of beds. And I want to reiterate, the staff are absolutely incredible. We're so lucky as a nation to have this NHS. It was in our 2012 Olympic opening games. That's how proud we are. And I feel like you criticise it all the time.
I think what that clip shows, obviously this is just one clip, but actually the polling backs this up, which is that people are not in any mood to blame nurses for the crisis in the NHS, because everyone knows nurses and they know that they're very hardworking people. So the Tories seem to have taken as their sort of big opponent this group of people, nurses, they want these high pay rises, they're a greedy bunch of lazy sods who need to work a bit harder. You can maybe make that up about some abstract group of people that no one has ever met. They've got a better chance with train drivers. Less people have met train drivers than they have nurses. They're still struggling with the train drivers because, it's not a good argument that they're trying to make. But with the nurses, it's a non-starter. Everyone knows nurses. Everyone has been in hospital and seen how hard they work. Everyone thinks they need to get paid more money. And so it's not a surprise that when the health secretary walks around a hospital, people don't take particularly kindly to him and they see him as the problem and why their operations or the operations of their children were cancelled, and not some nurses who don't want a pay cut this winter.
People do put the responsibility squarely on the Health Secretary, as well they should. But even before the ambulance workers and nurses strike were even on the cards, what you had was an enormously long waiting list. You had reports emerging of people who were dying in ambulances outside hospitals, dangerously long waits for ambulances if they were able to get one at all. Lots of people were being instructed to make their own way to hospital, even if it was quite dangerous to do so. And also just like a general sense that, when you were in a hospital or you're receiving care, that people were overstretched, overworked, underpaid, undervalued, and that does have an impact on the quality of care that you receive. So people have experienced this for quite some time now, and it's been a crisis which has been many years in the making. Never forget that the purpose of the Lansley reforms was to make the NHS more efficient. I don't think that anyone could say, hand on heart, that the NHS has become more efficient over the course of the last 10, 12 years. What instead we've seen are waiting lists, long ambulance waiting times, worse patient outcomes, lower job satisfaction for NHS staff, and also less staff retention overall. People are leaving the NHS because it's just not a good place to work anymore. And there's no one responsible for that other than the Conservative Party. And I think that one of the things that's interesting is that I think in terms of public opinion, and I also think in terms of some of the media narratives, the Conservatives are finally being treated like an incumbent government. They're finally being treated like the government who's been in charge all this time, and not just, we magically reinvented ourselves after we defenestrated the last leader who we decided that we didn't like anymore. And I think that that's something which is really starting to cut through and filter down into the popular consciousness, and that's what accounts for encounters such as these.